In a critical moment, knowing how to perform infant CPR can save a life. Today we'll learn the both thumbs technique. First, ensure the scene is safe. Then, check the baby's responsiveness. Gently tap the foot and call their name. If there is no response, have a bystander call for help and then you start CPR immediately. Place the baby on their back on a firm, flat surface. For chest compressions, use the both thumbs technique. Here's how. Place both thumbs side by side in the middle of the baby's chest, just below the nipple line. Your fingers should encircle the chest, supporting the baby's back. Press down smoothly, compressing the chest about 1/3 its depth. Perform 30 compressions at a rate of 100 to 120 per minute. After 30 compressions, give 2 gentle breaths. Cover the baby's mouth and nose with your mouth and blow enough air to make the chest rise visibly. Continue with cycles of 30 compressions and 2 breaths until help arrives or the baby shows signs of life. Remember, practicing these steps can make a significant difference. Take a CPR course to stay prepared. You just learned the both thumbs technique for infant CPR. For more life-saving tips, subscribe to this channel and hit the bell for notifications.